Hey guys, welcome back to Medical Coding with Blue. It is Vlogmas Day 2. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. This year for Vlogmas, I am doing my 25 days of modifiers. Now, I hope that this will help you. I will be leaving some links, some helpful links for these modifiers in the description box. So if you need additional resources, there you go. Check the description box. Now, with all of these, I'm going to be giving some examples, and I'm also going to be reading from websites that I find helpful as well. But I'm going to start off today's episode about modifier 24 by reading from the CPT Professional Edition by the AMA manual. I'm reading from the Appendix A because that gives you all of the definitions of a lot of the modifiers. So here we go. All right, modifier 24. Unrelated evaluation and management service by the same physician or other qualified healthcare professional during the postoperative period. The physician or other qualified healthcare professional may need to indicate that an evaluation and management service was performed during the postoperative period for a reason unrelated to the original procedure. This circumstance may be reported by adding modifier 24 to the appropriate E&M service. Now, what does this mean? If we have a patient who had a left knee replacement, right? And they are coming in a month later, okay? Because remember, a knee replacement is a major surgery, so it has a 90-day global period. All of the visits that occur within that 90 days that are related to that surgery are bundled, right? And it is part of the global package. They've already been paid for. So you cannot get an evaluation and management related to that, right? To that knee. So the patient comes in a month later and they're doing a checkup, and then the patient says, well, I also have numbness in my wrist and I'm having a hard time with gripping things, and my wrist hurts, And so the physician goes in and says, okay, well, I'm going to work you up and we're going to do some additional workup for this, and we're going to see about getting you to some physical therapy and that kind of thing, or just taking care of it in general. This wrist issue can be anything, and it is not related to the knee because it's not related, right? Anatomically, it's in a different location, and it is unrelated. So in this instance, we would give them the appropriate level of evaluation and management depending on what they did, right? And we would append a modifier 24 to that evaluation and management level. This lets the insurance basically know that there was a significantly separate E&M service that was performed during the post-operative period, right? And that's why we put a 24 modifier on there, because that says that this evaluation and management service happened during a post-operative period. And because, they saw them for the knee, they want to make sure that we're not talking about the same thing. We're talking about two different conditions, two different things going on. So that would be my example of when to append a modifier 24 to the E&M service. And of course, you would, if they were taking care of the knee, you would code for the aftercare for joint replacement, the joint that was replaced, and then you would also code for the any suture removals or dressing changes that they did as well, and you would report the CPT code 99024 because that says that visit is for the post-operative global period. So there is that. Now, here we go. So I'm going to be reading from this website. It's called WPS, Wisconsin Physician Service, the Government Healthcare Administrators, right? And this has a really good nifty fact sheet about modifier 24. So it says the definition: unrelated evaluation and management service by the same physician during the postoperative period. Appropriate usage: append modifier 24 to the E&M service procedure code. Use on an unrelated E&M service beginning the day after a procedure. So it's within the global period, right? When the E&M service is being performed by the same physician during the 10-day or 90-day postoperative period. So keep in mind, this even applies to like those nail removals that are like 10-day, that has a 10-day global package on it. If something happens and they come back for like a dressing change and they had a different issue and the provider has to work up that different issue, then you would be able to append that modifier 24 to that evaluation and management level, whatever is supported by the documentation. And that applies even to those 10-day global periods. So you gotta watch. And this is why I always say that it's important that when the providers are documenting that the patient had a surgery, what date did they have a surgery, so that we know. And it's not enough to just say, well, they're in the global period. You know, I should just be able to say that. It's very important to have the facts listed in the documentation at all times, okay? Especially on the outpatient side. We are not inpatient coders. We are coding based on what is in front of us on that day. So this is why documentation is very, very important. Use modifier 24 on the E&M if documentation indicates that the service was exclusively for treatment of the underlying condition and not for the post-operative care, okay? So again, the documentation plays a huge role in being able to apply a evaluation management code with that modifier 24. The use modifier 24 on the E&M code when the same physician is managing immunosuppressant therapy during the post-operative period of a transplant. So the way that it works is when they're on immunosuppressants, it is considered different. So that is why you will get an evaluation in management, even though this is for a transplant, okay? So the evaluation management with that 24 modifier, that is appropriate, okay? Use modifier 24 on the E&M when the same physician is managing chemotherapy during the post-operative period of a procedure. Again, something separate. When the same physician provides unrelated critical care during the post-operative period, okay? And I think that's pretty well self-explanatory on that. Inappropriate usage. Do not use when the E&M is for surgical complication or infection. This treatment is part of the surgery package. Now before it was like, oh, okay, well, if there was a problem, you know, then we had an E&M. Not so. So you have to remember that it's considered part of the surgical package because these things do happen. And that's what they say. These things do happen. Sometimes infection happens and sometimes complications happen. So this is considered part of the package. Do not use when the service is for removal of sutures or other wound treatment. This treatment is part of the surgery package. So if they're coming in for dressing changes or suture removals and things like that, you're not going to get a separate evaluation and management for that because it's already included in the global package. Okay, so that would be reported with the aftercare and then the dressing change code, right? And then you would also report that 99024 for the post-op global period CPT code. Do not use when the surgeon admits a patient to a skilled nursing facility for a condition related to the surgery. Self-explanatory. Do not use unless the medical record documentation clearly indicates that the E&M was unrelated to the surgery. So do not use that unless the medical record documentation clearly states that the E&M is unrelated to the surgery. Do not use outside of the post-op period of a procedure. Again, why it is so important to have the date of that procedure in the note so we know how far we are out from the global period, right? Or in the global period rather. And then do not use on the same date as the procedure. Okay. Note, and this is this website for the insurance company. It says, we determine payment based on the correct use of the modifier and any diagnosis on the claim. If a provider indicates they have additional documentation, we may develop for medical records. I think they mean we may ask for medical records. If we do not receive a response, we will deny the service. If we receive a response, we will pay or deny based on the medical records. And then they clarify that same physician, Medicare regulation states, physicians in the same group practice who are in the same specialty must bill and be paid as though they were a single physician. So sometimes the patient will start off the global period seeing the surgeon, and then sometimes they'll follow up with the PA, who also works in the same office, right? Because a PA is there to back up the surgeon. And so they're going to basically make sure that everything's okay. And so that this is not different billing for them. They are considered the same. And so that is what that means. So I hope that that was helpful for you all. Again, this only applies during a post-op global period when there is an evaluation and management service that is being performed during this time. So once you start getting into a good rhythm of being in the clinic and you start understanding what kind of procedures are performed, I work in orthopedics and podiatry. So I see minor procedures and I see major procedures. And I code for these patients in their post-op time, right? And so sometimes I will spot those opportunities for evaluation and management, and I will be able to pick those up. Sometimes the providers, they're selecting the codes, and I'm going through and auditing to make sure that they are selecting the correct code. But if I see that there's an evaluation and management service there, then by all means, I do pick it up based on their documentation. So, and I do apply the modifiers to that as well. So it's very important to review those, to understand when they apply, and that is just part of the whole deal of being a medical coder. So that is my show for today. Thank you so much for joining me, and I hope that this will help you, and I will see you for tomorrow's Vlogmas. Bye!